Hey everybody, I had not originally planned to do a Facebook Live for everybody tonight, but I just got done doing a live Q&A session for the private Facebook group that's part of my online program, and we got talking about a topic that's really important to me and something I feel really passionately about. So I thought, well, I'm feeling a little feisty about this topic, and so I'm just going to hop on Facebook Live with all of you and share a little bit of what we were just discussing in the private group. And we were talking about the issue of withdrawing kids from psychiatric medication and the problems that can come up with that. And you know, it's interesting, probably one of the biggest frustrations that I have in clinical practice is that so many parents and kids come to me who the kids have been put on psychiatric medication, and they and their parents have been given very little information about what these medications are, the potential risks and side effects, and many of the things that can go along with being on these medications. But very rarely does anybody have information that they've been given from their child's prescriber about withdrawing from these medications and problems that can come up with withdrawal. What's interesting is that many people in the field of psychiatry or medicine in general who prescribe these kinds of meds, they don't even like to use the word withdrawal in conjunction with these medications. In fact, if you read in a lot of the medical research literature or articles that are written about this, they don't like to use the word withdrawal about their medications, so they use the term discontinuation syndrome. Discontinuation syndrome, meaning problems that happen when you discontinue or stop these medications. And what's interesting is, I mean, you can call it discontinuation syndrome if you think that that sounds better, but the reality of it is, this is withdrawal, plain and simple. This is withdrawal trying to come off of antidepressants or benzodiazepine medications for anxiety or atypical antipsychotics or whatever the class of medication may be. There are problems that can occur for some people when withdrawing from those medications. And it's a very under-recognized and underappreciated experience that some patients have. And I really see the fallout of that in clinical practice regularly. I see families coming in where kids have been put on these medications. Parents were not told what the potential problems could be with withdrawing from these medications. So at some point, maybe they just stop giving the medication, or the prescription runs out and they decide to try without it. Or they talk to their child's prescriber about wanting to come off of the medication. And when these kids are brought down on these medications too quickly, they can end up having really, really negative experiences with that. And, withdrawal syndrome can be everything from feeling, physically kind of ill, nauseous, headachy, a lot of the same symptoms that people experience when they first go on these drugs. So they may physically feel somewhat unwell, but there can also be a ton of psychiatric, mental, brain-based side effects that happen when trying to withdraw from these medications. People can get rebound symptoms. That means that the original symptom that they were put on the medication for, when they start to taper down on the dose, reduce the dose a little bit, or start to come off of it, they get those initial symptoms roaring back far worse. Many people who have been on benzodiazepines, things like Xanax or Ativan for anxiety, can attest to this, that when they've been on that for a long period of time and their system becomes dependent on it, every time they try to wean back the dose a little bit, or if they try to go off it altogether, they end up with a terrible amount of what's called rebound anxiety or panic, where their symptoms are far worse than they ever were before when they try to come off of the medication. So it's really important for people to understand that coming off of these medications for some people is not a simple and comfortable process. It is for some people. Some people do fine going on these medications, and some people can wean off rather quickly or stop taking their medication and they don't notice any problem with it. But there is, a certain amount of people in the population who do struggle with that. And I see many kids and teens and young adults who have been through terrible, terrible times trying to reduce or wean the medications altogether. And part of the problem is that prescribers are very quick to put people on these medications, but they don't necessarily have a good knowledge base about how to comfortably and safely reduce the medications to titrate people off of them. And there's sort of this general way of thinking, which is, well, we just cut the dose in half for, a week or two and then go off of it. It tends to be the advice that many people are given. Or sometimes if they're on a very high dose, they'll tell them, maybe a series of 3 to 4 steps to titrate that down over a period of time. But I've talked to many prescribers where their thought process is pretty much, well, after a couple weeks, it's out of the system and it's done with. And that really goes against a lot of what we see in clinical practice with people. It goes against what some of the research literature shows, which is some people can be experiencing negative withdrawal effects from these medications for weeks, for months, or even for years after stopping these medications. And I maintain that if prescribers really were clear and accurate and detailed in the information that they provided patients and families about withdrawing from these medications when they first proposed them as a treatment option, many people would not pursue them. I've had so many parents say to me, if I had only known that these were potentially the problems that we were going to have trying to get our child off of these medications, we never would have started them in the first place. So I'm really passionate about parents and professionals, but in this case, we're especially talking about parents, you all being really aware of the potential risks of this for your kids. And if you do have children already on these medications, it's important for you to understand that some people really need slow tapering of these medications to comfortably get off of them. Now, how slow? That depends completely on the person. I've had children and young adults who I've worked with their prescribers to be able to titrate them off of medications over a course of weeks or maybe a month or two. And then I've had patients who it has taken us a year or 2 years or more to comfortably and safely wean them off. I had a young woman just the other day, 15-year-old, who was in the office for her, routine office visit with me. I see her about every 2 weeks now. And when I first met her a little over a year ago, she had been experiencing quite severe symptoms of depression and anxiety for about 4 years leading up to that time, so since early middle school. She had been placed on many, many, many different medications over the course of those 4 years, many medications in combination with one another. And when I first met her a little over a year ago, she was taking 3 medications at that time. And it was clear that the medications were not working well for her. She was still very depressed, very anxious, really struggling. And she had had a significant number of side effects from being on the medication. So we started talking with her prescriber about working together on a plan to start to reduce these. And his first response was, well, they're fine, she doesn't need to come off of them. But when the parents and I really pressed for a plan and for, wanting to try it, he basically said, well, this is the one we'll go off of first and just give half the dose for the next week and then go off of it. And it was very apparent from the first step of starting to reduce the dose of that medication that she was not going to handle that well. She felt very physically unwell, quite dizzy, sick to her stomach. She felt very cloudy-headed. And she'd been on these types of medications for many years. And it was clear that bringing her off of those medications that quickly was just not going to be workable. And so we ended up having to go through a process where it took us 11 months to wean her off of the medications. We did one at a time. We did them very slowly to keep her physically comfortable and mentally stable. And it was very interesting, and this is not unusual in what I see with many people. Her functioning actually began to improve as she came off of the medication. So for her, part of what was perpetuating her symptoms and her problems was not really the initial issues that she had started struggling with way back in 6th grade. It was now she was struggling with pretty severe side effects of the medication that she had been on. But the problem we ran into is we realized, okay, she's doing better having less of these medications in her system, but her system was so sensitive that we were not able to withdraw them quickly. She would have acute withdrawal effects when we would make, when the prescriber would make larger reductions in her medication. So we had to do it really slowly and really carefully, leaving enough time in between dosage changes and reducing the dose, sometimes 1/8 of a pill at a time. She was on, one of the formulas she was on was an Effexor, antidepressant medication that is a long-acting formula, meaning that the tablet itself, you can't tamper with it. You take it, at one point in the day and it releases slowly over a period of time. You can't cut that down. So that required the prescriber transitioning her over to the non-long-acting formula, the shorter-acting formula, which is a tablet that can be cut into pieces to be able to get the dosing where we needed to get it each step along the way to slowly reduce. And she was in last week, as I mentioned, for her regular appointment with me. And we had a little celebration here in the office because she was so excited that that day was her last day of taking her last dose. We had finally, after 11 months period of time, been able to comfortably and safely wean her off of all 3 of the drugs that she was on. She's doing wonderfully now. She's used, benefited from all the things that we've done in therapy, all the things that her family's been doing with her, a lot of the nutrition changes and the nutrient supplementation that we've been doing have really done a lot of great things for her. And so it was really a celebration that she's able now to not have to take these medications, and all of the work and the effort that's gone in over the last 11 months to slowly weaning her off of these. Finally, she was so glad to report that she was done with her last dose of that. And, she was a case where all the medical practitioners who saw her said, there's no way this is from medication, this dizziness, these things, it's not from that at all. This isn't medication effects. And yet, when you read the inserts that come with these medications, when you read studies that have been done on these medications and withdrawing from them, when you read case studies that are out there about withdrawing from these medications, her experience is actually not all that atypical for some people. It's very often the case that when parents or patients themselves go in to express concern to their prescriber, maybe about symptoms they're experiencing or that they're noticing in their child coming off of medication. With kids, often it can look like, increased irritability or not sleeping well or hyperactivity or moodiness or aggressive behavior or whatever it might be. When parents bring those concerns to practitioners in the process of withdrawing medication, there's usually a couple things that happen. The first thing is that they tend to be told, well, see, this is why you need to stay on your medication. I told you not to. It wasn't a good idea to take your child off of this because now you see all of these problems that result when you try to bring them off the medication. That's very often what parents are told. Here's what I want you to understand about that. That is not necessarily true at all. Not at all. If you are noticing that your child is having worsening symptoms or is having issues when you are withdrawing, either, weaning them off of the medication or they've recently come off of the medication, it is not necessarily the case that the child needed that medication and now they need to go back on it. What is very likely the case is that your child is experiencing withdrawal syndrome. They're experiencing withdrawal effects of having this medication in their system, and now it's been pulled out. And, as I mentioned before, withdrawal can look all different ways, for people when they're coming off of these drugs, but withdrawal is a very real experience, and it can cause all kinds of physical and mental kinds of symptoms. So please do not buy into the idea that if your child is struggling more or having new symptoms or having worsening symptoms when they've just come off of a medication or in the process of weaning, that automatically means that you need to increase the dose again or they need to go back on. It may very well be that they are experiencing withdrawal effects from that. So that's one thing that parents are often told when they raise concerns about issues that they're noticing in their kids when they start withdrawing medication. The other issue is that parents tend to be blown off about those concerns. They go into the practitioner and the practitioner says, nope, that has nothing to do with coming off of the medication, or nope, that medication's already out of your child's system. That's not what's going on here. And again, I want you to be empowered to understand that may very well be the issue. The withdrawing from the medication may be the issue. It can be an issue for days, weeks, months, or even years after coming off of those medications. So I just want you to really understand that your observations about your child are valid. And that if you feel like, or if your child is communicating that they're having more difficulties with foggy thinking, with, not feeling very well, with not being able to control their mood very well, with, whatever the case may be, whatever symptoms they're complaining about and whatever you're noticing, realize that may very well be related to withdrawal from the medication. Withdrawal is a real thing, regardless of what medical practitioners want to say about what's going on with that. They can call it discontinuation syndrome, they can call it whatever they want to, but it is withdrawal, and some people really struggle with that. And again, not everybody does, and some medications are more difficult than others. It has often been my experience that the children and the young adults that I work with in practice have a much more difficult time weaning down on their dose or coming off of medications that they have been on at higher doses for extended periods of time. So, a child who's been on a very high dose of a antipsychotic medication, for example, for 3 or 5 or 8 years, they may experience much more significant withdrawal trying to come off of that just because it's been in their system a lot longer. Now, that's not always the case, but it tends to be the case that medications that have been given more recently or at lower doses, you have less withdrawal with that. But again, it just depends on the person. It depends on the type of medication. So I just really want you to be aware of this issue, that if you're considering putting your child on medications, ask the prescriber before you even start the medication, what is it like to withdraw from this? What's the process for that? What should we anticipate if we decide the medication's not working, or we feel like there's increased problems, or whatever the case may be? What is the process for us to be able to get our child off of this medication? Talk about that ahead of time so you know what to expect and you know how the prescriber is going to approach that. And please, if you are talking to a prescriber about the possibility of using psychiatric medications for your child, ask the question, what are some of the potential problems, issues, side effects that might result from using this medication? Please ask that question. Not always do prescribers raise those issues with people. They should, but they don't always. So make sure that you ask, what are the possible side effects, risks, issues that we could have? If the professional tells you that there aren't any or that it's nothing to worry about, please find another prescriber to work with. Because a prescriber that tells you that there are no side effects, or it's very unlikely that there will be a problem, or you're being, overly conservative, don't worry about it, you're being too hypervigilant about it, that's a person who either is ignorant about the potential side effects of these medications, which is a problem, or they're just not telling you the truth. So ask these questions ahead of time. Find out what the process is for withdrawing so that you're aware of that when you're making the decision about whether you want to start the medication or not. For those of you whose children are already on these medications, be aware that if and when the time comes when you or your child wants to explore reducing the dose or going off, that may need to be done slowly and carefully, and that there should be a plan and a process in place to do that in as safe and comfortable a way as possible. If you are a parent who has a child who you've been trying to wean doses, or you've been going up and down on different medications and stopping medications and whatever the case may be, and you notice that your child's having a lot of issues, be aware that withdrawal is probably a big part of what you're dealing with, and talk to your child's prescriber about developing a plan to manage that withdrawal process in a more comfortable and appropriate way. It is very possible for many, many people to safely and comfortably get off these meds. Not everybody, unfortunately, but the vast majority of people can, but it needs to be managed carefully. So I just really wanted to share that with you tonight. I know this is an issue that comes up for a lot of families. It's a very confusing world to be in, trying to understand all of the things that are going on with medications and your kids and how to do all of this. And certainly I understand that you have a lot on your plate to manage, and it's hard to consider needing to keep updated on all of these medical things as well. But unfortunately, you need to be knowledgeable as parents, because many prescribers will not talk to you about these things. So I hope that this provided some good information for you to consider about the issue of withdrawal. I hope that for some of you who are maybe struggling with this, that it gave you some input and maybe some questions that you could go back and work with your child's prescriber on that. I hope it was helpful, and I'll be back soon to talk about another topic for all of you to benefit from. Thanks. Have a great night.